Well, today we're delving into a rare and complex congenital condition, bladder exstrophy-epispadias complex, or BEC. This presentation will explore the causes, effects, diagnosis, and management of this challenging condition, offering a deeper understanding for both healthcare professionals and families affected by BEC. The exact cause of BEC remains a mystery, but it's widely believed to be multifactorial. This means it likely arises from a combination of genetic predisposition and environmental factors during early fetal development. Research suggests disruptions in the normal migration of the mesoderm, the middle layer of embryonic tissue, can hinder the proper formation of the abdominal wall and the genitourinary system. While specific genes haven't been definitively identified, familial clustering has been observed, indicating a possible genetic component. Exposure to certain teratogens, substances that can cause birth defects during pregnancy, has also been theorized as a potential contributing factor, but further investigation is needed. The pathophysiology of BEC involves a series of developmental abnormalities that prevent the normal closure of the lower abdominal wall and the anterior bladder wall during gestation. This failure of closure leads to the bladder being exposed on the outside of the abdomen. The degree of involvement varies, resulting in a spectrum of conditions. In bladder exstrophy, the bladder is completely exposed. Epispadias, a related condition, involves the urethra opening on the dorsal, or upper, side of the penis in males or clitoris in females, rather than at the tip. Other associated anomalies can include separation of the pubic bones, malrotation of the kidneys, and abnormalities of the genitalia and anus. The constant exposure of the bladder mucosa increases the risk of infection and long-term complications if left untreated. Bladder exstrophy-epispadias complex is a rare condition, affecting approximately 1 in 1,000 to 50,000 live births. Bladder exstrophy is more common than cloacal exstrophy, which is an even more severe form of BEC. While it affects all ethnicities and geographic regions, some studies suggest a slight male predominance in cases of bladder exstrophy. Understanding the epidemiology of BEC is crucial for resource allocation, research prioritization, and providing accurate information to prospective parents. The signs and symptoms of BEC are often evident at birth. In bladder exstrophy, the most striking feature is the exposed bladder on the lower abdomen, appearing as a red, moist mass. Urine continuously leaks from the open bladder. Other signs may include separation of the pubic bones, a shortened penis in males, and wide-set nipples. Epispadias is characterized by an abnormally positioned urethral opening. Infants with BEC are at increased risk for urinary tract infections, skin irritation around the exposed bladder, and long-term complications like bladder cancer if the condition is not properly managed. Diagnosis of BEC is typically made prenatally through routine ultrasound scans. These scans can often detect the exposed bladder and other associated anomalies. After birth, the diagnosis is usually clinical, based on the physical examination of the newborn. Further imaging studies, such as X-rays and MRI, may be performed to assess the extent of the anatomical defects, including the condition of the kidneys, ureters, and pelvic bones. Genetic testing may also be considered to rule out other chromosomal abnormalities or syndromes associated with similar presentations. BEC can present in various forms, with bladder exstrophy, epispadias, and cloacal exstrophy representing a spectrum of severity. Bladder exstrophy, as we've discussed, involves the exposed bladder. Epispadias involves the abnormal urethral opening and can occur independently or in conjunction with bladder exstrophy. Cloacal exstrophy is the most severe form and involves a more complex malformation, including exstrophy of the bladder and rectum, imperforate anus, and omphalocele. Understanding these classifications is critical for tailoring treatment strategies and predicting long-term outcomes. The primary goal of treatment for BEC is to achieve urinary continence, preserve renal function, and create functional genitalia. The initial approach involves surgical repair, typically performed in stages. The first stage, usually done within the first few days of life, focuses on closing the bladder and abdominal wall. Subsequent surgeries may be needed to correct epispadias, address bladder neck reconstruction, and improve urinary control. Physical therapy, particularly pelvic floor exercises, may be recommended. Lifelong follow-up is essential to monitor kidney function, manage urinary tract infections, and address any complications that may arise. The psychological and emotional well-being of the child and family are also important aspects of comprehensive care. Currently, there's no known way to completely prevent BEC, given the complexity of its etiology and the involvement of multiple factors. However, women planning to become pregnant should adhere to general recommendations for a healthy pregnancy. This includes taking folic acid supplements, avoiding smoking and alcohol consumption, and managing any pre-existing medical conditions. Prenatal screening and early detection through ultrasound are crucial for identifying BEC and allowing for appropriate counseling and planning for specialized care after birth. The prognosis for individuals with BEC has improved significantly with advances in surgical techniques and multidisciplinary care. With successful reconstruction, many individuals can achieve urinary continence and lead fulfilling lives. However, long-term complications, such as bladder dysfunction, urinary tract infections, and an increased risk of bladder cancer, remain a concern. Recent research focuses on developing improved surgical techniques, exploring regenerative medicine approaches for bladder reconstruction, and identifying potential genetic markers for BEC to improve prenatal screening and counseling. Continued research and collaboration are essential for further enhancing the long-term outcomes for individuals affected by this rare and complex condition.